Health CS Mutahi Kagwe is this morning holding a consultative meeting on the blood crisis in the country, just a day after calling on DCI to investigate a case of cartel that has been hoarding blood donated by well-wishers and selling it to Somalia. Mutahi Kagwe yesterday said that the cartel is part of a litany of challenges that have locked the Kenyan blood transfusion system that has seen the amount of blood drop to just a pin. Let's listen into that conversation. The CS is currently speaking.
Is deliberating because deliberations are still going on. But what I can tell you is that the stakeholders have made certain proposals going forward. For example, the issue of the bill in Parliament, and we want to manage blood not as a department in a ministry, but a standalone authority within the ministry, as a saga within the ministry, because clearly we have not been giving sufficient attention to this area that is so critical. So we are departing from the point of view of a patient needs blood, a mother delivering a child needs blood, and working backwards from that perspective, ask ourselves, what therefore do we need to do to ensure that there is no shortage? The blood is where it is required, it is there at the right time, it is there at the right quantity, and it is there as good, clean blood. We don't want a situation where we give somebody contaminated blood. As you are aware, there has been gaps within this sector. We have even asked the criminal department, the criminal investigations department, DCI, to intervene in the system, because we understand there are people who very surprisingly and very immorally are actually selling blood, sometimes even outside the borders of this country, and that is just making the situation even worse than it would otherwise be. As Governor Kuti has rightly pointed out, the idea is to regionalize the whole blood collection process. And one of the areas that we want to give weight to is addressing the people who actually give us blood and asking ourselves, who are the blood donors that we have? Blood donors are patriots. They are patriots who want to support other Kenyans. And they are people who give their own. They give their blood is very personal. And they give it so that they can support somebody else. A young man will give blood so that he can support a mother. A young lady will give blood so that they can support a sister who is also unwell, or give blood so that somebody who has an accident can get blood. So we want people to think about this. If you are a border rider, you want to know that if another border rider or your mother or your father were to be taken to hospital, there will be blood there. And the only way you get blood is if you donate blood. But people who are blood donors also want to know that blood is for the purpose for which they are giving. And they want to know that there is a very transparent way in which it is managed. So these are the deliberations that we are carrying out today. We also want to understand how we can predicate this blood management on ICT so that it is possible to trace and track blood from the minute you give it to the minute it is used. We know where it went through, we know who gave it, and we know who it was given to. So these are some of the changes we are discussing today, and hopefully by this evening, in another 1 hour or so, when they finish the deliberations, by this evening we will come up with a proper framework of how we are going to manage blood in our country. Even as we wait for Parliament to enact the proposed law that we are going to take to them, we are also going to be taking measures to, through regulation, create a framework that can immediately embark on the changes that we want to make, so that when the law is passed, we will simply transit into that framework legally. But that is not the fact that we are waiting for the law to be enacted does not mean that we cannot immediately start making changes. We are also very happy that the government itself, the donor community, have expressed that they, as long as we have got a transparent framework, they are willing and able to fund us for this purpose. So thank you very much indeed.
Other questions?
If there's a question, we can take 2 questions. Yes, please. Okay. First, the bill is actually already in Parliament. It is the same bill we are talking about. But what we are doing is, as stakeholders, it is not debated yet. So it's a bill in Parliament. We are involving stakeholders so that they can input, their contributions to the bill. But let's not also forget that a lot of them had actually contributed. But there are new things that have come up. For example, the issue of the counties. How do we work with the counties to ensure that every county, for example, can have blood storage so that if anything happens, they are able to access it quickly. That's an expensive exercise. There are things that are going to be done immediately. There are things to be done in the medium term, and there are activities for the long term. That's one. On the issue of PEPFAR, we are very grateful. And we are very grateful to PEPFAR and USAID generally for the support that they have given this sector. And I think it is good for us to call a spade and take responsibility, because the transition from PEPFAR funding to Kenya government funding is what did not occur as it was supposed to occur. So we are filling the gap as a Kenya government. We are filling the gap. But as I also said, we have also got supporters who are willing to step in. Specifically, the World Bank has been willing to step in and assist, even as we try to transit again the second time to a self-funding mechanism. I think we must, as Kenyans, face this issue head-on. We cannot be relying on donors for our own blood. We have to fund it as a government, and we have to fund it as Kenyans. Well, I really can't comment on the investigations that are currently going on. I think you read in the papers yesterday that DCI has already stepped in. Obviously, when an investigation is going on, you don't want to disclose everything about it. But what I can tell you is that there's an investigation going on, and we expect arrests to be made. Thank you all very much. Yes.